Welcome to Nz-Osce learning sessions. Today we will discuss Station 1 Mental Health Assessment. You will be given 2 minutes to read the scenario carefully. The settings will be provided within that case, whether it may be a neurological ward, psychiatry ward, morning or evening shift, and identify the person by his name, date of birth and NHID. The situation, you have to understand the situations, what has happened to that patient and their current condition. For example, are they depressed or anxious in this station especially? In regard to background information, check for any relevant information such as relevant medical history, so underlying any diseases or any past surgical history. In assessment, review the evaluations that conducted for that patient. In recommendations, we have to assess the problems and convince the patient in a therapeutic communication. It is necessary and especially required in this scenario. Make sure you read precisely and analyze the details very carefully. You need to complete our recommendations within 8 minutes. That means you have to aim to practice completing them in 6 minutes. As always, begin by promptly entering the area, by knocking the door. Always ensure that scene is safe to approach. Once you entered, you have to ensure the primacy for the patient. Meanwhile, you start doing hand hygiene motions and introduce yourself simultaneously along with the purpose of your visit. Like hello, good morning or good evening. I am so and so, a registered nurse. Today I will be taking care of you. I received a call back from your room. Do you have any concerns or something bothering you? In this station you can ask, you seem so anxious or you are so depressed. What's really bothering you? If the patient started to address a concern, you have to empathize first, then only you have to provide appropriate suggestions. Listen attentively, empathize, and then only you have to provide suggestions. Throughout each stations, you have to maintain a therapeutic communication. Always try to encourage the patient to share additional information. Explain your suggestions in a clear and straightforward manner. For example, if the patient said, I'm not feeling good, I'm alone, I'm worried, I don't know what happened to me. So your reply should be, I'm so sorry to hear that. I can understand your situation. Then first of all, you have to ask them, do you have any idea regarding what happened to you? What brings you here? If not, let me explain you in detail. So then you have to address what happened to them. You were in market or somewhere, someone called 111. Ambulance team brought you or rapid response team brought you here in the emergency department, done all the basic investigations. So you are under observation. Am I clear to you? Again, you have to, if they are comfortable, you may ask for better confirmation or for better communication. Could you please state your name, date of birth, NHID please, for the verification purpose. Then the patient may reply you that my name is so and so, my date of birth is, NHID is. If not, the patient is not willing to answer you, you can ask me like this way, like show me your wristband for verification. Once they provide adequate information, you have to thankful to them, like thank you for sharing your valid informations. So make them comfortable. And again, move on with this concern. Try to explore their emotions. You have to ask that, is there anything else you want to share with me? Something bothering you? Then the patient may answer yes or no. Yes, I am worried about this particular reason. They are alone. Then again, you have to empathize. Oh, I totally understand your situations since it's happened unexpectedly. If you don't know to provide accurate suggestion in this particular case, always make sure that you have to suggest that let me discuss it with my team leader or let me discuss it with my charge nurse regarding this particular issue. Like that way, you have to continue your conversation in a therapeutic way. You may ask, is there anyone nearby to take care of you, or whether I have to contact anyone for you? They may say yes or no. If no, they don't have anyone nearby, then you have to offer, we do have a social support system. We will inform them regarding your situation and always ensure that everything is taken care of. Once you address this, once you suggested this, you have to ask, how does that sound? Is that okay for you? Am I clear to you? Okay. Then, if the patient is not going to settle down, then they will ask, or you may ask, could you please help me for this? Sometimes, if the patient is comfortable with you, they may ask you, could you please help me for that? Or could you please arrange me for this? I am much worried about my so and so reason. They are not answering to me. I don't know what happened to them. It happened unexpectedly to me. So again, you have to empathize. Oh, really, I can sense your feeling. What do you think? Maybe she went for a pre-scheduled activities, or maybe she went for a shopping or any appointments. Then you have to ask, is there anyone nearby, whether I have to check on with her? They may say that yes or no. If yes, okay, you can ask, is there anything else? Or no, you have to again give the suggestion that I totally understand your concern. Let me inform the social worker regarding this. I will make sure that your entire concerns will be taken care of. Is that okay for you? So you have to move on with like this. You have to, once they address the concern, first you have to empathize, then only you have to provide adequate suggestions. Once they know that you are maintaining the therapeutic communication, in between you can feel that they are comfortable with you, you can ask that it would be fine if you could sit and talk. Sometimes they will say yes. If no, then you have to move on with that patient. It's okay. Then you have to continue that conversation like this way. Moreover, do you have anything else you would like to share with me? If no, then we have to move on that way. If yes, they are saying another concern regarding I had an appointment after long waiting time, I want to go right now. Again, you have to say, like, empathize. I acknowledge your concern, but you are not in a situation to do so, or not advisable to move on with that. Then you have to suggest that if you are allowing, I will inform your GP regarding your situation, and I can reschedule if you are allowing me to do so. Is that okay for you? So, always make sure that while addressing a concern, empathize, then you have to give appropriate suggestion for that. I trust this clarifies how to initiate a conversation at the station in a therapeutic manner. Be confident in your communication with patients. It truly makes a difference. So stay tuned.